Herd immunity. Is it a reality? Does it work? Can it protect the people against COVID-19 in the absence of a vaccine? If observations in Brazil are any indication, then herd immunity is not a solution to this pandemic. Cases are once again on the rise in Manaus. The city of nearly 2 million is the capital of Brazil's state of the Amazonas, and it has closed bars and river beaches to contain a fresh surge of coronavirus cases. Now, local authorities have enforced a 30-day ban on parties and other gatherings, and restrictions have been reimposed on restaurants and shopping hours as well. Manaus was one of the hardest hit cities in Brazil during the first wave. In April and May, the city's medical infrastructure collapsed and cemeteries could not dig graves fast enough. Even then, the city never imposed a full lockdown. Non-essential businesses were closed, but many simply ignored social distancing guidelines. As a result, the death toll in Manaus has neared 2,500 due to COVID-19. Now, if Manaus was a country, it would have had the second highest mortality rate in the world. Nearly 100 people have died in the city per 100,000 population. A recent research report published concluded that 44% to 66% of the Manaus population was infected between the peak in mid-May and August. And the study was conducted by the University of Sao Paulo's Institute of Tropical Medicine, and it suggested that the high infection rate led to herd immunity. The study credited the same herd immunity for a drop in new cases and deaths. Now, the COVID-19 daily death toll in Manaus officially peaked at 60 on the 30th of April. However, by August, the daily death toll had plummeted to just 2 or 3 a day. Now, new cases and deaths had dropped dramatically, even in the absence of a vaccine. So was herd immunity the reason? Had Manaus become the first major region in the world to benefit from herd immunity? A recent uptick in cases has dashed those theories. Even if a degree of herd immunity was achieved, its impact is not lasting. Infectious disease experts believe that antibodies against COVID are effective only for a few months, which means that a person can be reinfected over and over again. So experts say that the erasing of restrictions has contributed to the recent surge in cases. Authorities have warned of a second wave of infections, and residents are being urged to wear masks. Manaus' river beachfront, where raves are often held, have been shut and restrictions have been reimposed on businesses. The mayor of Manaus has blamed President Jair Bolsonaro for encouraging a return to normal life instead of waiting for a vaccine. But this resurgence of new cases is not limited to Manaus. Herd immunity or not, fresh infections are on the rise in many regions around the world, especially in Europe. And the strict lockdowns imposed earlier this year have failed to eliminate the disease anywhere in the world. A case study on the failure of herd immunity in Manaus has come as a major setback. Herd immunity is not even a medium-term solution to the pandemic. The questions now facing Bolsonaro and other world leaders are the same. Should they reimpose lockdowns to contain a second wave of COVID-19? How will a second lockdown help contain the virus when the same approach failed before and the global economy is shattered? So can developing and underdeveloped nations afford to reimpose lockdowns at the cost of their stumbling economies?
Já chegou a 201 dos 217 municípios. Segundo o governo